We're excited that you've chosen Medical City North Hills to have your spine surgery, and we hope to answer all of your questions. We want you to be very comfortable and very happy with your experience throughout your entire stay here. If you have questions, please ask them. Take notes and use the resources that we have available to you. We're excited that we've been accredited by the Joint Commission as a spine center here and have specialized physicians, nurses, therapists, and procedures just to care for patients requiring spine surgery and their recovery. This video is to help you be prepared for surgery and answer any questions that you have. On the day of your surgery, you will come to the outpatient department. The parking lot for the department is located on the northwest side of the hospital. When you enter the outpatient department, you'll come in through the pre-op doors. There's a desk there, and this is where you will go to check in for your surgery. You should at this time have brought with you a complete list of your medications with the name, dosage, and times that you take them. If you are on any type of blood thinner, we do need the name of the blood thinner and the amount you take, but you should have stopped those blood thinners 5 to 7 days before your surgery. You will also be asked to provide any over-the-counter medications that you also take. You will then be asked to change into a gown. The nurse will then review your history, review your medications, make sure that you have had nothing to eat or drink after midnight, and then they will start your IV. When we start the IV, we will try to stay away from the wrist area or the elbow area, due to the fact that you may be using a walker after surgery. The nurses will also ask you if you had showered the night before and the morning of with the soaps that were provided for you. If the surgery is going to last anywhere from 2 to 4 hours, there is a possibility that you will wake up with a urinary catheter. If this is a concern, please let your physician know and talk about that with them prior to coming to the hospital. Any type of spine surgery could last anywhere from 45 minutes up to 4 hours. Once you are done with your surgery, the physician will then find your family and take them to our consultation room. This provides privacy for the physician and your family as they let them know how the surgery went and how you're doing. At this time, you will be going to the recovery room, where you'll be waking up from the anesthesia. And once you have met all the requirements from waking up, you will then go up to your room where your family will meet you. When you return from surgery, you'll come to the 6th floor, which is a med-surg unit with 17 private rooms. There you'll be taken care of by a variety of staff members. There will be nurses who have been specially trained. There will be patient care techs who will be taking your vital signs, helping you with bathing, and getting you up and down to the bathroom. There will be physical therapists and a unit supervisor or charge nurse. All of these people will be helping to provide care for you in your time in the hospital. You will also be given instructions to review during your stay, and the nursing staff and therapy staff will also refer to these instructions throughout your stay. We want you to be well prepared to care for yourself at home. Respiratory therapy here at Medical City North Hills will help you with oxygen through a nasal cannula. When you come out of surgery, you're going to either be on pain medication or still under anesthesia, and you're not going to want to take deep breaths. Deep breaths are important for the healing process and to keep lung illnesses away. Another thing to expect is the respiratory therapist will ask you to work on an incentive spirometer. The incentive spirometer helps you take deep breaths and helps keep your lungs inflated and keep secretions from accumulating in your lungs. The respiratory therapist will come in and instruct you on how to do your incentive spirometry. Once you're on self-use, you'll pick up the incentive spirometry and use it 10 breaths per each hour. The first piece of equipment that we'd like to talk about is your IV or intravenous line. This is important because it helps to deliver medication and fluid throughout the course of your hospital stay. However, it may be that we stop delivering medications and fluids through the IV a day or so before discharge so that you can take these medications by mouth. If at any time your IV monitor starts beeping, please notify your nurse. Next is the possible use of a PCA pump. PCA stands for Patient-Controlled Analgesia. The pump allows you to help control when you're given medication, typically about every 10 minutes. You can push the button and hear a beep as pain medicine is delivered. If you don't hear a beep, it typically means you've pushed the button before the next available time for medication. Normally, you'll have your PCA for 1 or 2 days after surgery, and then you'll advance to taking your pain medications by mouth. 2 possible complications following your surgery are blood clots and infection. We use a combination of sequential compression devices while in bed, And we will have you wear TED hose to help with compression and swelling, if ordered by your physician. To prevent infection, you'll be receiving antibiotics prior to and after surgery. It is important that your incision not be submerged into water until you are cleared by your physician. Bruising and swelling is common after surgery. When it comes to pain and pain control, we work on a 0 to 10 pain scale, 0 being no pain whatsoever, and 10 being the worst that you could possibly imagine. Most of our patients say the highest level of pain while they're here is somewhere between a 7 or 8. We would like for you to be between a 3 and a 4, whatever your acceptable pain level is, so that you can function and do things like therapy, eat, get up and go to the bathroom. Your job in helping us maintain you at this level is to let us know when your pain starts to creep above that. When you reach a 5, then you need to let us know that your pain level is starting to rise, because that indicates that the pain medication is wearing off. We do have patients that don't want to take too much pain medication, and so they think they'll wait until they can't bear it anymore before they'll take the pain medication. What we found is that you actually take more pain medication at that point than you do if you just allow us to maintain you at the ideal pain level. We have IV pain medications and oral pain medications. IV pain medication is great in that it works very quickly, but it also metabolizes very quickly, so it doesn't last very long. The oral pain medication can take about 45 minutes to reach full effect, but then it also maintains the pain level for you between 4 and 6 hours. Starting off, you may want to alternate between the two methods, and then as you progress in your healing, we'll work on maintaining you on the oral pain medication because that's how we'll be sending you home. Side effects of pain medication can be nausea and issues with bowel movements. The anesthesia itself, not getting up and walking around as much as normal, and the pain medication can all slow down your bowels. We will be giving you a stool softener on a regular basis while you're here, and then we have other medications which can help you as well. It's not required that you have a bowel movement before you leave to go home. Because of the pain medication and the anesthesia that can take several days to completely leave your system, we want to make sure that you do not fall. Your job in helping us to do that is 1, to not get up by yourself. We want you to only get up with the assistance of staff members. 2, we'd like for you to wear the grippy socks. To prevent infection, you'll be receiving antibiotics prior to and after surgery. Your dressing may be changed prior to discharge, but once discharged, your dressing needs to remain clean, dry, and intact until you follow up with your physician. The nurses participate in rounding, meaning we will check on you every hour and a half to 2 hours around the clock. This is to ensure we are meeting all of your needs. This does not mean we'll wake you up every 2 hours. However, we will wake you up every 4 hours because we want to make sure your pain stays at a manageable level, which will allow you to be able to work with physical therapy. It is easier to stay ahead of the pain and keep it at a lower level than to have it catch up to manage it. We'll also be using various other methods than just pain medication to help control your pain. One option will be a polar ice machine or an ice pack. The polar ice machine is basically an ice chest with a motor which circulates the cold ice water through a pad which is placed over your surgical area. At home, oftentimes people will use frozen refrigerator packs. We also will use warm packs and cold packs to help encourage you to continue these measures at home, especially after therapy, which will help with your pain and swelling at home. With spinal surgeries, you will sometimes have pain that is not specifically related to the surgery itself. You might have pain related to other issues, such as muscle spasms or nerve pain. After the surgical procedure, you're going to feel more comfortable standing in an anatomically natural position, where the muscles are not used to being in that position, and it can create muscle spasms. We can give you pain medication for that, but it is not going to help the underlying causes, so you need to let us know when you're having muscle spasms so that we can give you muscle relaxers to allow those muscles to go back to a natural position. Often before the procedure, you may have numbness to your arm or leg. This is caused by pressure on the spinal nerves, which is not allowing signals to go through normally. After surgery, when the pressure is relieved, those signals may go through normally. This may happen all at once or in spans of a few hours or even days after surgery. Nerve pain can feel like a burning sensation in your arm or leg. This does not necessarily mean anything is not right. It can be part of the healing process. And if you'll let us know, we have medications which work specifically on nerve pain, so it can be relieved and you can heal and proceed with your recovery. With some spine surgeries, depending on if they've done an anterior or a posterior approach, there are a few things you need to know regarding precautions following the surgery. Just remember BLT. No bending, no lifting, and no twisting. Your surgeon will clear you when it is safe to return to these activities. On average, these precautions are in place for 6 weeks. Because of your surgical precautions, there are some pieces of equipment that you'll need to purchase prior to surgery. This includes a sock aid, a long-handled shoehorn, a reacher, and a long-handled sponge. More information about where to purchase these items are included in your packet. Please bring this equipment with you, along with 2 to 3 pairs of loose, baggy clothing. The therapist will instruct you in how to use this equipment and practice getting dressed. The doctor is not going to want you to have eaten for about 24 hours. We can provide mouth swabs and mouthwash to help keep your mouth moist, but do be prepared that there is a chance you won't be able to eat for the first 24 hours. There are times that you're in a hurry when you're trying to get up and go to the bathroom, but if you'll give us an extra 20 seconds, then we can put on the gait belt. It goes around your abdomen, and it gives us a nice center of gravity location to help assist you with balance in case something happens. Sometimes with the medication, 2 or 3 steps from the bed, you may get a little dizzy or have some vertigo. All of those things contribute to your fall risk, and we do not want that to happen. To help you remember this, we'll have alarms on the chair and on the bed to help you remember when you get up to call for some assistance. They're not meant to be punitive. They're just simply there to help you remember. We ask that you not let your family members assist you with this, simply because our staff is specially trained in procedures to help protect your safety. Therapy that you will be receiving in the hospital after surgery will start on the day of surgery, as therapists will come in and begin to evaluate your mobility. We will begin with the basics such as sitting up on the side of the bed. Your therapist will teach you safe techniques to protect your surgery. After sitting, we will progress to standing and then to walking. It may sound extreme to start doing these things so soon after surgery, but research has shown that early mobility improves rehab outcomes. The therapists will use a poster to communicate with you and the rest of the hospital staff your progress towards your goals. We have 4 goals for you. The first goal for you is to be able to walk 150 feet. The second goal is we want you to be able to walk without any physical assistance. Thirdly, we want you to be able to stand up from a chair or a commode without physical assistance. Finally, we want you to be able to get dressed and bathe without physical assistance. Since everyone is unique and progresses at different speeds, you may still require some physical assistance in one or more areas when it comes time to going home. Depending on your support system, you still may be appropriate to go home. We will be happy to recommend a rehab facility if you're requiring moderate or maximum physical assistance in these areas. Case managers will be assisting you with your discharge planning needs after your surgery. The social worker will stop by your room the day after your surgery to discuss your progress with therapy, and then determine a discharge plan that best suits your needs. Whether you need to go for inpatient rehab, home with home health, or outpatient rehab, we will work with you to make those arrangements. We will take into consideration your insurance benefits and work with you to assure that your success will continue well beyond your hospitalization. In order to help with your discharge planning, you should reference a few forms: the Discharge Resources Form and the Discharge Planning Questionnaire. The Discharge Resources Form lists local inpatient rehabilitation centers, home health agencies, and skilled nursing facilities. Take a look at this list. Feel free to call the facilities. Check with your insurance or even stop by for a visit to pick the facility that feels best for you. The next form is your Discharge Planning Form. Please fill out this form and turn it into a staff member. If you have any questions about the form, we'd be happy to answer them for you. The purpose of this form is to find out about your living situation and your family support, so that together we can make the best plan to set you up for success at discharge. Once at home, it is important to watch for signs and symptoms of infection or a blood clot. Signs and symptoms of an infection are an increase in redness, heat, or swelling, a fever greater than 101.5, or an increase in drainage or a change in its color. Signs and symptoms of blood clots are a red, hot, swollen area in the calf or arm, or pain with bringing your foot up. Call your doctor if you notice any of these signs or symptoms. Sometimes there are no obvious signs of a blood clot if you start to experience difficulty breathing. This could be a sign of a blood clot that has traveled to your lung. If you experience this, you need to call 911. Although these can be treated easily, it is very important that they are treated immediately because they could become life-threatening. As always, we are here to help you recover and to return to a normal level of activity as soon as possible. Please let us know if there's ever anything at all we can do to help your surgery and recovery go as smoothly as possible. Thank you for choosing Medical City North Hills for your surgery.